Welcome back to my channel. Today's topic could truly save lives. We're going to cover some of the most common symptoms of cancer and why being aware of them could make a world of difference. I'm Dr. Smrita Singh and I'm an MD and wellness expert. Now, before we dive in, let me clarify a few things. Just because you have one of these symptoms doesn't mean you have cancer. These are often non-specific signs and there are many other potential causes. However, it's essential to pay attention to changes in your body and consult your doctor if these changes persist or worsen. Also, the best way to catch cancer early is to keep up with the recommended screenings. Think pap smears, mammograms, colonoscopies, and other preventative exams. These screenings can detect cancer before symptoms even start, giving you the best chance of catching it early. Now, let's get into the top symptoms you need to be aware of. Symptom number 1 is fatigue. Now, we all feel tired sometimes, but we're talking about extreme, worsening fatigue that doesn't improve with rest. Cancer can consume a lot of your body's energy, especially when the immune system is trying to fight off abnormal cells. Cancerous cells may also interfere with the body's normal functioning, causing exhaustion. If you've been feeling drained for no apparent reason and it's not improving over several months, it's worth getting checked out. Remember, fatigue is common and could be due to various things like stress, poor diet, or lack of sleep, but persistent fatigue needs to be evaluated. Another critical sign is unexpected weight loss, especially if it's around 4 kgs or more, over a few months without a clear reason. Many people think weight loss is a good thing, but if you're not trying to lose weight and it's happening rapidly, you should pay attention. Unexplained weight loss could indicate cancers like those affecting the digestive system, liver, or pancreas. Cancer can disrupt the body's natural balance, affecting appetite and metabolism, which leads to weight loss. Next up, let's talk about eating issues. Loss of appetite, difficulty swallowing, or persistent belly pain could be signs of something that isn't right. For example, patients with upper abdominal cancers might experience ongoing nausea, vomiting, or a feeling of fullness after eating only a small amount. There aren't many screening tests for cancers like stomach or esophageal cancer, so if you're experiencing these symptoms, make sure to talk to your doctor. Another red flag is any unusual lump or swelling. Lumps can appear in areas like your neck, armpits, or groin, and it's essential to check for them regularly. If you notice anything unusual in your breast or testicles or any other part of your body, get it evaluated by a doctor. Sometimes swelling is a benign cyst, but it's best to rule out any possibility of cancer. Pain that doesn't seem to go away or worsens over time is something to pay attention to, especially if it's in your head, chest, abdomen, or bones. For example, children might complain of arm or leg pain, which can sometimes be mistaken for growing pains, but could indicate something more serious. Any pain that's not relieved by changing positions or doesn't respond to usual treatments should be evaluated. Skin changes are another symptom that can signal cancer. Keep an eye on new lumps, sores that don't heal, changes in moles, or a yellowish tint in your skin or eyes. When it comes to moles, remember the ABCDE rule: asymmetry, irregular borders, color changes, diameter over 6 mm, and evolving appearance. The A stands for asymmetrical. One half of a cancerous spot or mole may not match the other if you were to split the mole in half. Non-cancerous moles are typically symmetrical. B is for border. The border of a cancerous spot or mole may be irregular or blurred, or it may be pink or red in color. A typical spot or mole is likely to have well-defined borders. Next up is color. A typical mole tends to be evenly colored, usually a single shade of brown. A cancerous spot may not be the same color all over. It can be several shades of the same color or made up of several colors, including tan, brown, or black. They can even include areas of white, red, or blue. Amelanotic melanomas are harder to detect. They don't change melanin, so they're the same color as your skin. They're often diagnosed late because of this. The diameter of the spot or mole is also important. It may be a warning sign if it's larger than 1/4 of an inch across, that is 6 mm, which is about the size of a pencil eraser. Also note if the spot is evolving. Spots due to melanoma may grow or change color or shape. They may also start to itch or bleed. Benign, non-cancerous spots and moles usually don't change. If you spot anything unusual, get it checked promptly. A cough or hoarseness that doesn't go away might signal lung or throat cancer. Even if you're a non-smoker, these symptoms should still be checked out, especially if they're persistent or getting worse. This also goes for any hoarseness that lasts longer than a couple of weeks. Don't ignore it. Unexpected bleeding or bruising can also be a sign of cancer. This includes blood in your urine or stool, bleeding gums, or heavier than usual periods. Sometimes cancer in blood-forming tissues like leukemia can affect how your blood clots, leading to easier bruising or bleeding. Keep an eye out for changes in bowel habits like constipation or diarrhea that doesn't resolve, as well as unusual stool changes such as black or ribbon-like stools. These symptoms could indicate colon cancer. Blood in the stool should always be investigated, even if you think it might be due to hemorrhoids or other cause. For both men and women, changes in urination like pain, blood in the urine, or needing to go more frequently could be signs of cancer in the bladder or prostate. Men should also watch for a weak urine stream or needing to get up multiple times at night to use the bathroom. Night sweats or fevers that are persistent, especially when combined with other symptoms like weight loss, may also be red flags. While these can be linked to infections, if they persist, it's worth a checkup. Pay attention to any worsening headaches, changes in behavior, balance issues, or vision problems. Neurological symptoms might be linked to brain or nerve cancers. If you or someone you know is experiencing these changes consistently, don't delay in seeing a specialist. Now, I know this list might seem overwhelming, and many of us have experienced at least one of these symptoms at some point. The key takeaway here isn't to stress over every little symptom, but to recognize when something feels different or isn't going away. I like to explain it to patients this way. Look for 2 P's, persistence and progression. If a symptom sticks around and continues to worsen, it's time to consult your doctor. Cancer can be daunting, but remember, early detection can make a tremendous difference in treatment success. By staying informed and paying attention to your body, you're taking a proactive step in your health journey. If you found this video helpful, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe for more content on health and wellness. Hit the notification bell so you never miss an update, because staying proactive and informed can truly make a difference. Stay healthy, stay safe, and I'll see you in the next video.